Hello, my name is Jeff Richardson, Vice President and Chief Operating Officer for Shepherd Pratt Health System and Chair of the Board of Directors for the National Council for Behavioral Health. Each year, National Council honors individuals and organizations that have set themselves apart as leaders in behavioral health. Honorees that reflect the innovative and inspirational work across the country and remind us of the power of advocacy to bring about permanent and positive change. During these difficult times, our behavioral health care professionals, consumers, advocates, and community champions are stepping up to advocate for vital mental health and addiction services. Their selfless efforts in the face of COVID-19 are saving lives and strengthening communities behind the scenes. These awards allow us to highlight achievements in public policy arena and how they impact our member organizations' ability to provide the best treatment for individuals living with mental illness and substance abuse issues. We would not be here today without the generosity of our partner, Sanofi Pharmaceuticals. It is with their unwavering support that we're able to honor the work of our award winners today. Thank you for your partnership. We would also like to thank everyone that sent in nominations of their peers. The support that we have for each other enables us to celebrate our successes and share what we have learned so we may build a better tomorrow today. Our Advocacy Leadership Awards honor an elected official, individual, and organization demonstrating exemplary efforts and results in promoting behavioral health policies that increase access to mental health and substance use services. Our first award for public service and advocacy honors the first elected LGBTQ African American in Colorado's General Assembly. She has championed mental health and substance use legislation, including the passage of a bill that creates a 0.25% sales tax in Denver, raising approximately $35 million annually for mental health and substance use treatment funding each year, and increases access for thousands of Denver residents who may not previously had access. Throughout the COVID-19 pandemic, she has been a voice of LGBTQ plus older adults, bringing attention to the prevalence of feelings of isolation. She is committed to ensuring that the people of Denver continue to have access to mental health and substance use treatment during this time, when the need is greater than ever. Our 2020 Award for Public Service and Advocacy goes to State Representative Leslie Herod from Denver, Colorado.
Whether in the workplace, the home, or in our everyday communities, the stigma associated with mental health and substance use challenges persists. Every day, people struggle with balancing their needs for treatment with anxieties about risks to their homes, their jobs, their families, and more. In this time of added anxiety and stress due to the pandemic and a global movement proclaiming that Black Lives Matter, the need has never been more great. I am proud to be a voice to help address the devastating impact that this pandemic is having on the mental health and recovery of our state's most vulnerable citizens. I know firsthand what addiction and mental health struggles can do to a family, and it's nothing to be ashamed of. In fact, my personal struggles have helped me to inform how I approach policymaking. I am so proud of what my colleagues and I at the state level have been able to achieve to improve access to mental health and addiction treatment. But on a personal level, and having honest conversations about mental illness and addiction, we have made great strides in the prevention, treatment, and recovery that so many Coloradans need. This includes just this session, prevent and reduce the harm of substance use disorders in our communities by allowing pharmacists to sell non-prescribed clean syringes, permitting nonprofits and health facilities to operate clean syringe exchange programs, and increase access to life-saving opiate agnostics. Additionally, at the city level, I'm proud to have championed Caring for Denver, a 2018 ballot measure that passed with overwhelming support, creating the largest mental health foundation in the state. Caring for Denver raises about $35 million annually for mental health and substance use treatment right here in Denver for children and adults. And I'm so proud to serve as its inaugural chair. Thank you to the National Council for Behavioral Health for this award and for your dedication to America's healthcare organizations that deliver mental health and addiction treatment and services. I also want to thank the Mental Health Center of Denver for nominating me for this award, and to all of the staff that make a difference in people's lives every single day. And thank you to the individuals who share their personal stories, the friends, colleagues, and elected officials that have opened their hearts, opened their minds, and are improving the lives of many Coloradans. And I want to give a special thank you to Lorez Meinhold, our executive director for Caring for Denver, for all of our dedicated staff, for all that you do for our communities right here in our home city. I'm committed to working with you to bring about the further change that we need to ensure that everyone in our communities get the mental health and substance use treatment that they need. It should no longer be pushed to the side. We must address this issue. We need to address it face on. And I'm so honored to be able to be with you in that work. Thank you.
Our next award recipient began her career as a social worker, providing services to the most vulnerable. She transitioned into advocacy work, and by force of her personality, intelligence, and vast knowledge and understanding of government policy making and advocacy, has championed transparency and persevered services through major system changes, including the transition to managed care and response to the COVID-19 pandemic. She can simultaneously focus on the micro and macro levels and see how decisions at the federal level trickle down to the state level, to the counties and the communities where the impact of those decisions are felt acutely. The award for individual achievement in advocacy goes to Lori Cole, Executive Director of the New York State Council for Community Behavioral Health.
I want to thank the Board of Directors, the members of the nominating committee, and all of the staff and members of the National Council for this award. I also want to send my thanks and gratitude to the members of the New York State Council for your constant partnership and support. You are the heart of our organization, and I stand in awe of you and your staff for your bravery and perseverance. I have led several membership associations and worked in many organizations during my career. But without a doubt, the New York State Council is the mightiest army I know. Together, we pack a powerful punch with access to care as our true north. The New York State Council has taken on insurance companies that were violating state laws. We push state regulators to make sure the behavioral health space is seen as equal to the physical health care space. Our work has resulted in significant reforms that have empowered our members as they struggle to remain viable, and to ensure care recipients get the care they need at the right place with the right amount of support. Reform isn't easy in New York State. You can't always control your outcomes, but you can definitely control the way you conduct your business. Our organization is seen as an honest broker. We use facts and data, and we conduct ourselves with integrity, and our work is paid off. Recently, the Council led efforts to achieve rate parity and continuity through the system transition to managed care. We worked with lawmakers to pass a bill that many insurers wanted to stop. Our insistence on transparency has resulted in millions of dollars that might otherwise have been lost to the state's general fund being directed back to our system of care. This shows the power of our collective voice, coupled with our belief that nothing is insurmountable or too in the weeds. Millions of Americans have been profoundly changed by the opioid epidemic, by suicide rates that are increasing across the country, and the tragic murder of George Floyd that has galvanized many people to acknowledge that systemic racism must be addressed. We know that many of those we serve and those who staff our programs face this injustice every day. They are the reason we fight and will continue to do so. I am grateful to the public officials and lawmakers, state agency representatives, and fellow advocates who have traveled this path with us. I am deeply grateful to John Caston from the Jewish Board and Charlotte Osman from the Mental Health Association in Westchester for nominating me for this amazing award. I know how incredibly blessed I am to have my life, my loved ones, and my work, and to be surrounded by such generous and brave members. I am hopelessly devoted to all of you. Working this job and standing side by side with you makes me incredibly happy, and I thank you for this honor.
Last but not least, we celebrate an organization that represents leading mental health care and substance use providers who treat New Jersey residents with mental illness, addictions, or co-occurring disorders. as well as the families of these individuals. As the pandemic roared into New Jersey, this organization worked with state leaders to ensure the necessary work was done to resolve MAT issues, as well as prevent recent increases in the long term residential SUD rates from being cut. Their advocacy during the pandemic has also led to several big wins, including legislation for expanded telehealth. The award for organizational achievement and advocacy goes to New Jersey Association of Mental Health and Addiction Agencies, being accepted by Deborah Wentz, the organization's president and CEO.
On behalf of the New Jersey Association of Mental Health Agencies, I accept this award with infinite gratitude to the advocate par excellence, Chuck Ingolia, and the policy team at the National Council, Michael Petrocelli, Rebecca Farley-David, and Neil Comstock. From the Latin advocare, advocacy means adding a voice or support to a cause or person. Over time, NJAMA, as we're known, has developed strong relationships at all levels of government that provide the avenue through which we are able to lend our voice both for individual and systemic issues. NJAMA has always remained very visible through TV, radio, print media, and social media. By testifying regularly and sharing publications, in arranging tours for both the administration and legislators, as well as by attending the many press and other events, including bill signings that we are invited to. We reciprocated by remaining readily available at all times to respond to, assist with, and partner on issues of concern to the state, and even to those at the federal level. Many of our successes can be attributed to our strong relationships with key leaders that are built on trust and on partnership. Given the traumatic effects from both the COVID-19 pandemic and the social injustice brought to light by the horrific incident of George Floyd's death, more children and adults than ever before are in need of mental health and addiction services. Individual and systems advocacy for sustained and increased funding, regulatory flexibility, equipment for telebehavioral health, and to ensure that all individuals have equal access to housing, nutritious food, childcare, education, and opportunities are an imperative for us all. Through advocacy, we empower ourselves and level the playing field for all humans by becoming their spokespersons. At NJAMA, advocacy only is effective with the participation of everyone. So this award is the result of the efforts of my staff, board, members, and their staff, all working together as partners in advocacy. I do want to extend my sincere appreciation to my board under the leadership of our chair, Bob Budsock, and vice chair, Susan Lowry, as well as my staff, with a special shout out to our policy team, Mary Abrams, Senior Health Policy Analyst, and Shauna Moses, Vice President, Public Affairs and Member Services. But every single member of the staff have a critical role in executing our advocacy strategy. Thank you again for this recognition, which affirms together we can and we will continue to make a difference. Our work has only just begun.
Congratulations to all the winners for the remarkable and impactful work they have done. You are an inspiration to the entire field of behavioral health. Please visit the award page on our event website to learn more about our award winners. You can also leave a message of congratulation by visiting the award stage. Thank you.